Did you know that roughly 75% of workplace assaults occur in a healthcare setting? We live in a time that healthcare workers consider workplace violence as part of the job. Today, I want to encourage you to take a stand against workplace violence in our healthcare industry. I want to persuade you to make a difference. Our healthcare providers face workplace aggression daily, with 45% of all workplace violence incidents occurring in the healthcare setting. Staff is distracted from providing essential medical attention to those in need. Because most of our healthcare workers think workplace violence as part of the job, many of these incidents go unreported. According to Modern Healthcare, surveys and reports suggest that many of these incidents do go unreported in our healthcare industry. This chart here is from the U.S. Bureau of Labor Statistics. It shows the number of workplace injuries in healthcare compared to those in the private industry. The red line is healthcare, and the black line is our private industry. Dr. Tom Milojevic, President and CEO of Cleveland Clinic, states, "There is a very fundamental problem in the U.S. healthcare system that very few people speak about, and that's the violence against healthcare workers." He goes on to say, daily, literally daily, we're exposed to violent outbursts. Fortunately, there are a few things that can help diminish the occurrence of workplace violence in our healthcare system. Implementing de-escalation techniques into our healthcare facilities is one thing we can do to help minimize workplace violence. According to Quick Safety, some positive consequences of de-escalation techniques have shown to prevent violent behavior, reduce patient anger and frustration, and improve staff-patient connections. De-escalation techniques may include isolating an individual, watching your body language, and using reflective questioning, according to John Delbel in RN. Providing access to these de-escalation technique trainings would be an effective way to help diminish workplace violence in our healthcare industry. And this here is a list of verbal intervention principles provided by our Crisis Prevention Institute. So we've got remaining calm, isolating an individual, watching your body language, keep it simple, use reflective questioning, embrace silence, and check your paraverbals. Implementing higher quality security systems is another thing that could help minimize the occurrence of workplace violence. According to Lydia Goutre, with Modern Healthcare, hospitals have to strike a balance between security concerns and offering easily accessible facilities for patients to seek care and others to visit their loved ones. UH is working on implementing a system that will alert staff to patients who were violent or angry at a previous visit. Some things that may increase security quality at hospitals would be medical detectors, police presence, and panic buttons. We can visualize the benefits of minimizing the occurrence of workplace violence against our healthcare professionals by contrasting the care provided. When workplace violence occurs in our healthcare industry, wait times to receive medical attention are increased, the quality of care provided to patients decreases, and staff is distracted from urgent medical emergencies. If we take a stand against workplace violence in our healthcare system by focusing on de-escalation techniques and security systems, wait times will decrease, the quality of care being provided would increase, and staff could focus on emergencies. In closing, I urge you to take a stand against workplace violence in our healthcare system. Simply speaking up and promoting de-escalation techniques and better security is all I'm asking so we can make a difference. Thank you.